Okay, so this is the meeting of January 26th, Wednesday of the Tri-Town Boards of Health. I'd like to call the meeting to order. And first of all, I'd like to ask for a motion to approve the meeting minutes, the last meeting of 1/6/22.
I make the motion, we approve the meetings from January 6, 2022.
Thank you. A second.
Second.
All in favor?
Aye.
Okay, thank you. Now, at the last meeting, the meeting before that, actually the meeting before that, we had a suggestion from a doctor in the community that the boards of health consider the idea of a vaccine passport. In other words, that food establishments would have to verify the vaccination status of people that before they entered the establishment. And that has been, I think, is a subject of great public interest. And so we decided at the last meeting, as you recall, to have a dedicated meeting for that tonight. So the main part of this meeting will be to discuss that particular idea. In particular, we'll have a bit of an overview by the board. I'd like to have I know that's of great interest to the board members as well. So I'd like to have, before we get into public discussion, the board members, if they have anything to say something about this. And then what I'd like to do is I'd like to open the discussion up to the public so that the public can get a full a chance to say what they want about this. Now, there are a large number of people participating, so we're going to try to manage that with the technological capabilities that we have here. So please excuse us if we have a little bit of a difficulty with that, because we've had some difficulty even starting this meeting. But in the meantime, we'll do the best we can with it. Now, after that public discussion regarding this particular concept of vaccine passport, we're going to, at a later, before we close the meeting, we're going to have a second public discussion. We'll call it citizen speak time. This is a bit like what happens in other boards, not just boards of health, but other places, where you can really talk about, the public can present whatever ideas they want. So I'm going to ask the public, when they discuss during the first part of the public discussion, when we're discussing the vaccine idea, because it's such a complex issue, because there's so many people interested, that we could focus on that issue when we do it. And then we can reprise the discussion. If you have something else to add, if you want to talk about a completely different subject, we'll do that before the entire meeting is over. But I would just ask that as we go on. So the first part of this meeting will be an overview by the board, and I'm going to ask the board members now, as they wish, to speak up about this and just give their opinions before we let the public speak about what they think about this issue. Does anybody particularly have something to say? Does anybody want to say something? Please go ahead and say it if you want.
Well, go ahead.
Okay,
I'll
Diane, do you want to start off? Okay, do you want to start?
I guess. So I'm grateful for the opportunity to be able to do this tonight and to devote some time just to this. I want to make sure that the public knows we're not voting on anything tonight. We just decided that this was, like Dr. Kenny said, an opportunity to explore more of it and hear what everybody had to say, businesses and residents and everybody else. But there's no voting going on. There's nothing planned. It was just an open forum to get going. So I appreciate everybody being interested. Early in the month, I had an opportunity, thankfully through Jen Nacht at the chamber, to meet with a lot of the local restaurants in town. I think totally between phone calls, emails, and a Zoom, I must have hit 12 restaurants. All of them were pretty much in alignment, and you can understand where they're coming from. 2 years of fatigue. They're worried about their staff. They're worried about their patrons. They're really worried about their businesses and the impact it's going to have. So this now becomes a very complicated situation for everybody to try to address and make sure we know what's going on. In the end, though, I think as a board, we need to take the long view out. I don't think this is going away very quickly. It may transform itself repeatedly over and over again. So I think we've got to take the long view that living with it, there's things we have to consider on how to live with it. to make every space safe for everybody that lives in our town. And that's about it.
Thank you, Diane. Would somebody else like to say something? Joanne?
I just feel that I agree with Diane that it's not going away very fast. We've been living with it for 2 years plus now. I know I'm not a health professional, but I'm a school teacher and I deal with little children every day with their germs and all this. And we've managed to be safe in an environment where food happens, recess happens, those kind of things. And I agree that with the business owners that this has been tough times. And I feel that we live in such a small area with so many people that can't find employees. We would cripple people by imposing this. Not only that fact, but to expect someone to have a vaccine is also expecting people as Americans to do something that they feel against, which I also am an American. Not saying I didn't get vaccinated. I'm just saying that I believe people should have choices. And if your choice is you don't feel safe in a restaurant, then maybe you shouldn't go in there if you don't feel safe, because everybody should have the right to go out. And I get that it's a virus, but as it's gone on, it seems like it's less and less detrimental to the broad spectrum of people. I'm not saying there aren't people who aren't at risk, but there's people at risk for diseases every single day. So I do feel that we should also listen to the restaurant owners who this is their livelihood. And I believe that we'd be killing their livelihood in this small area we live in. It's not New York City. This is Berkshire County.
Thank you, Joanne. Would somebody else like to speak? Carissa, would you like to say something? You're muted.
No, thank you.
Okay. And John, would you like to say anything?
Not yet.
Not yet. Okay. Ray, would you like to say anything?
Well, as somebody who's caring for people with COVID, it just seems to me like, it isn't ending. I agree. I also do feel for, the restaurant owners. It's really mucky waters for sure. I don't want to see any more businesses close. I feel like it can be a suggestion again, strongly advised suggestion. I feel like if we mandate, the anger is just going to continue. And certainly we have been subject to that anger. Again, if I had my druthers, everybody would be vaccinated and everybody would be masked, but I don't. And I personally I'm run down by it all. And frustrated. I'm going to continue to do my part by masking and washing and sanitizing, and preach to the choir that everybody else should too. And that's, I guess, what I have to say right now.
Okay,
I'm
thank you very
discouraged.
much, Ray. Thank you. I'm sure we all feel a lot like that. Henry, you want to say
Yeah.
something?
Well, I'd like to say for the restaurant owners, I feel it's kind of a double-edged sword in that if there was such a mandate or directive, as we talked about, it might keep out people who would promote, the business of the restaurant. However, it could work the other way. If that does not happen, there are a bunch of people in this area in Berkshire County who would not feel safe going to restaurants. They're fully immunized and they would not feel safe going to a place where people are not immunized. So it is a double-edged sword for the restaurant owners.
Thank you,
Can I
Henry.
just say one more thing, Charlie?
Yeah, go ahead, Ray.
So the triplex, I think, is thriving very well. And in order to buy tickets, you have to, it's mostly online. You have to, when you go in, show proof of your vaccination. You're seated with your party. There's 2 seats in between. That's why you have to pick out your seats online. And I think they're doing okay, but you know, you can also keep your mask on there. In a restaurant, you're asked to walk in with a mask and then you get to take it off while you eat. So it does seem a little bit like an oxymoron too.
Okay, I understand it. Noel, do you want to say something? You have to unmute yourself there. Noel, you're still muted. Can we unmute Dr. Black, please, Jim?
I have it, I think.
Good, okay, thanks.
Yeah, I'm just getting the drift of the conversation. I'd rather withhold comment just now.
Okay. Bob, do you want to say something?
Well, there's a lot of topic related information that we can use, but I'd just like to say something briefly about the process tonight. And that's that it's helpful for me to hear as many new and different ideas from as many different sectors, so to speak, or arenas of the community. There's a tendency, I've been in several of these Board of Health areas where we've had public input, and sometimes it can get bogged down in repeating the same concern over and over. And that's okay too. We wouldn't quiet anybody down necessarily, but for me and my eventual recommendation based on facts and feelings and trends, et cetera, it helps to hear as many new ideas from different areas, different folks as possible, rather than maybe louder and differently worded same thing, you know, that I don't know what it might be, that they don't like the color of the white vaccine passport or so. But all that aside, the process is not a vote. It's not a referendum. And it's really an information gathering. And so my preference is to hear from as many people and as many different ideas about this topic as possible.
Thank you, Bob. I think that's very well put. I think that's the intention of the board in general tonight is to not to make any specific decisions, but to try to put forth as much information as possible. In a democracy, you certainly have the right to want something and to voice what you want. And that's a very important aspect of democracy. You say what you want and whatever. Another aspect of discussion when we have to make decisions ultimately about public health is to get information that we can rely on. So we have these 2 different processes. Naturally, I see it, I always see it in a kind of an extreme way to start, a reductio ad absurdum, to start in a almost ludicrous situation. It's certainly the case with respect to coronavirus, I would think, that if we mandated to the public that everybody live in a box in the woods, that they would be safe from coronavirus. And I think that would be, if we could focus totally on being safe from coronavirus, and we could say that that was our ultimate priority, and we could tell people to live in a box in the woods, and they would probably be safe from coronavirus. But what kind of life would they have? And what other things would they be giving up in order to just live in a box in the woods? Obviously, people have other concerns simply than being safe from coronavirus. And I think that's what we're going to hear tonight. And I think that another aspect of this, especially when we're asked as a board to consider the idea of the safety, the public safety with respect to doing something like vaccination card verification, is to understand whether or not doing that is actually what some people would like it to be. You know, I'm not as knowledgeable about this as some of the other doctors are, but I do know that getting a handle on the reliable information about this is very difficult. And I see, just from my review of hundreds of scientific articles, a lot of which I didn't understand, but when I did more research on it, I began to understand how difficult it was for these people doing the studies to actually put forth ideas that made a lot of sense. The idea is even a very simple idea of, if we're going to think about the idea of the safety of people in a restaurant when they go in after they've shown that they've been vaccinated, who are we keeping safe, and from what? And when you deal with the safety of vaccines, we can have many different levels of thinking what these vaccines do. We can say to ourselves, well, we'd like the vaccine to protect us completely from disease, so we don't have disease at all. And so if we go into a restaurant, we'd like to know that if everybody's been vaccinated, we want to know that they don't have any disease. But from what I can tell from reading scientific papers about this, you can't be sure that somebody who's been vaccinated doesn't have the disease. The problem is even worse with this Omicron, but the idea becomes even vaguer when you say to yourself, well, I was vaccinated, but I was vaccinated in May, or I was vaccinated in June. And some of the studies show that after 20 weeks, the neutralizing antibodies levels drop considerably. And so you wouldn't expect to be as protected from the disease after 20 weeks as you were right away. And when are we going to say that that person is safe to go into a restaurant versus not? And we also know that people that have been vaccinated, we know that in the Commonwealth of Massachusetts now, that we've had 400,000 breakthrough cases in Massachusetts alone. That's 1 in 14. If you take all the people that have been vaccinated and you take the numbers of people who get sick anyway, the 1 in 14, at least in terms of what they know about, has been ill after the vaccine. Now, a lot of people are testing themselves at home now, so we don't even know how many people have been sick. So the idea of somebody thinking that they're going into a restaurant safely, not getting the disease, not being exposed to the disease because there's been some kind of inspection of a vaccination card, I don't think is a logical idea. It doesn't make sense to me to feel safe if you're worried about the disease, if you're really worried about the disease, to go into a restaurant, even if people have been vaccinated, because if 1 in 14 can carry the disease, then what are you being safe from? Now, on the other hand, when you look at vaccination status and you look at the Omicron in particular, the Omicron, I think the CDC identified the first Omicron case in the first week in December. And now the CDC is saying that 99.9% of all the cases are Omicron. So this disease has gone through us tremendously. It's been very fast. But with respect to Omicron, the numbers of fatalities and the numbers of seriously ill people when you've been vaccinated is considerably lower than it was with the earlier Delta variants and the other ones. So in fact, actually, the people that go into the hospitals that are very sick and are hospitalized, they haven't been vaccinated. They're the ones that haven't been vaccinated. If you've been vaccinated, you're protected. It's not, apparently it's evolving into something that's not much worse than the common cold. So the idea of feeling safe, it sounds to me more and more like being less anxious when you go in a restaurant in an irrational way. On the other hand, I don't want anybody who doesn't believe in vaccinations to think that I'm supporting the idea of not getting vaccinated. I agree with Joanne. If somebody doesn't want to get vaccinated, they have the right not to do that. But people who in a democracy, you can't always win everything. You have to cooperate. We have to work together. If you don't want to be vaccinated, then be careful of other people. Have respect for other people. And be sure that you don't violate the rules of masking and public distancing and things like that. Be very careful about that. Similarly, if somebody's afraid of being sick and dying from going in a restaurant from the disease, do takeout. Don't go in the restaurant. Okay? The restaurants have done a good job so far. They've done an excellent job. They really have borne a lot of the burden of this disease. You know, we're all stressed, but it's their businesses. And I don't see that from my point of view, and I'll be quiet now, I don't see that imposing further burdens on the restaurant business is the good way to go. But we do have to use this opportunity now, and I hope the public discussion will show this. We have to move together into the future. This disease is not going away. We have to base it on knowing what we're talking about. We have to, if we're going to make decisions, it has to be based on consideration of everybody involved, not just our own personal rights to go and do something, but what does it mean for somebody else if we just go and do what we want? We have to make concessions that are similar to driving on the road. Yes, you should be able to cross the line if you want to, but you're going to kill somebody. So we accept the idea that we're not going to do that. Okay, we have to accept other ideas that endanger people and limit our rights, but we shouldn't do it unreasonably. But I want everybody to know, and I just want everybody to know this for sure, because I know that people on this board have worked very hard to understand this disease, and we will not go forward and make decisions about this disease unless we've done a really good job of doing the best we can to figure out what is the truth about it, not just what everybody's worried about. We can't let fear ruin our democracy or our local government. Thank you very much. And Noel, you haven't spoken yet. Would you like to say something?
Well,
Before
not
I
at this
open it up
point.
to the public discussion. Okay, well, if everybody else on the board is content, Jim, would you like to say something?
Thank you, Mr. Chair, for all those comments. And I don't want to belabor because I think people want to speak. It's just, I think there's a lot of confusion out in the public that we were pursuing a proposal or a mandate, and there's nothing on the table. This was an opportunity to bring people together, have a conversation, and some board members have worked with the chambers. I've gotten tons of email inquiries, which I've forwarded to the board, but just a couple points from the health department perspective. And so for those that don't know, we have access to the MAVEN surveillance disease system, meaning every reportable disease comes through our secure system where the nurses do contact tracing for COVID, influenza, so on and so forth. And since the outset of COVID started in March of 2020, when we were really doing robust contact tracing, we haven't found any clusters associated to indoor dining per se. Yes, we've had employees that may have contracted COVID out of the workspace, and then they're out and it may have shut down a business because they couldn't staff it. But we don't have any clusters, even to this day, associated with indoor dining. Second point is, we do have to start to transition to what the new normal looks like. And I think we're already incrementally working towards that. For example, we're not doing contact tracing anymore unless it's for schools or congregate care facilities. So we're dialing that back, meaning if a DPW gets exposed, we either do an at-home test or a drive-through test, or they get referred to a PCR test, but we're not doing contact tracing anymore. The schools, as we speak, including my children's school, are already getting away from the pool testing. They're opting out of pool testing. It's a significant it's labor intensive. Joanne, she's one of our old school teachers from our boys. It's very labor intensive. They're getting away from that. They're sending at-home tests with that. So the more we transition to at-home testing, the more we're going to have to start to normalize. And in the last piece is, the numbers are starting to trend down. Will be interesting to see what the next 2 or 3 weeks lie. But we've done drive-through testing, and there was a major demand for that right after the holidays, but that's really tapered off. And I think there are signs that we are moving to the new normal, but I just want to let everyone from the public know that we have not identified any association that restaurants were causing cluster cases in our community. Thank you, Mr. Chair.
Thank you, Jim. That's very, very important information. Do you want to report on any of the status of Southern Berkshire at this point before the public discussion, just so we can see more specifically where we are with the numbers?
So if people, I just did a screen share. Hopefully people can see that. You'll see from January 16th through 22, as compared to the previous week, we're down significantly in Lee. We're down in Lenox. Stockbridge is up a little bit, but that's a it's a specific issue, but hopefully we're going to continue to trend down. And I don't think it's going to be a significant drop off. I think it's going to be a gradual over time decrease. Hopefully that continues to happen.
Jim, we have about a 75% vaccination penetration in the county, don't we? Of the eligible people for vaccination, about 75% have received at least 2 doses.
That's what I've seen.
Would anybody else on the board like to say anything at this point before we open up the discussion, the public discussion? Okay, so what I'd like to do then is I'd like to invite the public to raise your hand. Jim and the staff of Tri-Town will be in charge of
Yep.
Ordering the people that, putting in order the people that raise their hand. We'd like to give you 3 minutes to speak. And then we will ask you to stop at least the first time around. There are a lot of people that look like they may want to speak. So we want to give everybody a chance to speak. And after everybody's spoken, if somebody else wants to reprise an issue, please come forward. And I think, that's it right now. So Jim, I'll turn it over to you to let people talk.
Yeah, so the people will raise their hand. So what we'll do is we'll unmute you, but then you have to unmute yourself and then you have the floor and then we'll lower your hand. So the first person in order is Brian Beckett. Go ahead, Brian.
Can you guys hear me?
Yep.
I live over at 31 Austin Ave in Pittsfield, Mass. I volunteer in Lee. I actually lived in Lee for 2 years up until I recently moved to Pittsfield. And I wanted to bring a unique perspective that I think a lot of folks are not considering when it comes to these mandates. Basically, I think few people, especially in our region, disagree with vaccines. I think what we're discussing today is kind of the right to choice and persuasiveness. I think persuasion is really the only way to do this without the vitriol and the anger and the rage that you guys had mentioned that you're seeing. And I think that is really, from a democracy, what we expect from our elected officials is to persuade us or hear from us and our persuasive kind of takes on these things. It should not be by, I guess, executive mandate and fiat that you guys are determining these types of things. It sounds like that is not the case. And I actually appreciate the perspective of everybody that has already spoke and kind of told us what your feelings are. So there was a piece that came out at the end of the year. I think it was December 1 or November 30th or something like that from the Globe. And it spoke to vaccination rates in impoverished and minority communities. I don't know if anybody's familiar with that, but in it, and this was 2 or 3 months ago now, we were seeing vaccination rates in some of these minority communities and some of these impoverished communities across the state, vaccination rates of like 10%, 15%, 20% for children. And what these mandates would effectively do is ban large swaths, 80, 90% of these minority groups across the state from being able to come and do business or participate, in the Tri-Town and to, I guess, come and give their money to these businesses and patronize them. I think that right now there's about a 34% unvaccinated rate for African Americans across the state. And I think with Hispanics, it's about 28% in our state. And so I look at it from a really unique perspective, I think, which is that these mandates are disproportionately affecting folks that are already struggling in our state and are already not necessarily getting a fair shake. I think that I agree with the businesses that this is not the way forward and that this is not the right thing to do. I think leaving it, up to choice for both the folks that want to patronize these businesses as well as the owners and management of these businesses, I think that's the right way forward. I think that's going to, equate in the most equitable outcomes for everybody to be able to kind of find that path forward. And I think it's something that people are not talking about, kind of the disparate impact of these mandates on, the minority communities in our state. It's not right. It's not fair to them. And we should be looking at ways to further include these folks and further educate, on the benefits of the vaccine, rather than, forcing them out of our community and out from our businesses. So that's really all I wanted to say. Thank you.
Thanks, Brian. Livio Sanchez, you're up. You just unmute yourself.
Thank you, Charles, and thank you, everyone, for having this meeting. My name is Livio Sanchez. I am a resident of Beckett. I actually just moved up here a year ago, almost exactly a year ago. And I just found out about this meeting tonight through a friend. And I came here because I'm an independent filmmaker. And I was at an event this weekend in Washington, D.C. called Defeat the Mandates, D.C. About 35,000 people approximately showed up to march. They do have mandates in DC. You cannot go into a restaurant unless you have your Vax Pass, or any indoor facility, meaning if you want to get food and you are unvaccinated, you can't. So I'm just here actually piggybacking on the previous speaker, and the question I asked both all the speakers that I interviewed, as well as the people that attended the march, I started the questioning with, how do you feel about freedom of choice, sovereignty over your body? As an American issue, I think those are important things to consider. Where does this go? The event itself was attended by people on all sides of the political spectrum. I actually met more vaccinated Democrats than but there were Republicans and there were unvaccinated, and there were firefighters and teachers and lots of doctors and nurses and frontline workers, and they all came together in unity to fight this authoritarian taking away your freedom of choice. And one of the things that we don't discuss these days is informed consent. There's still a lot of data that we don't have. We don't know the long-term effects of these vaccines. So I'm just here to support the conversation and the open dialogue, which I think is wonderful in our community. And also to share that there is a movement out there already to try and defeat the mandates. And there is a website, defeatthemandatesdc.com. Again, I'm independent. I'm trying to look at this from a journalistic standpoint. I don't have a horse in this race, but I think it's an important conversation. And thank you.
Thank you. Micah?
Yeah, hi, thank you. My name is Micah Mortale, resident of Pittsfield, work in Stockbridge, 16-year resident, Berkshire County, and really appreciate the open-mindedness, the tenor of the meeting so far tonight. Wasn't sure what to expect from the board. It's my first time at one of these, and yeah, I really appreciate your approach, that you're wanting to listen to the public. A lot of the points that I had come prepared to share have been touched on. So I guess what I'll focus on now is I am concerned about the impact of the vaccine passport as a part of the new normal in America. I'm concerned about the impact of us as a people being conditioned and becoming used to having to show our papers to confirm medical status as an exchange for participating in society. I think it crosses a frightening line. We're at a point right now where if this goes forward, it seems to me that we'll have to exchange basically becoming lifelong profit centers for big pharma, an endless series, as it sounds right now, of experimental injections in order to basically participate in society. And, it started out as, one and done with Johnson & Johnson. And then, the 2 boosters with Pfizer, and then now a 3rd booster and a 4th booster and a 5th booster. And there'll be no end to the boosters. We, as the previous speaker said, we really don't, there are no long-term safety studies. There are none. There are no long-term safety studies on these products. So informed consent is very important. And our ancestors, many of us had grandparents who fought in the Great Wars, went overseas to stop authoritarian, totalitarian governments who were trying to get involved and encroach on every aspect of our lives. And I think it's a fundamental part of our constitutional republic that we do value the rights of the individual and the individual's choices, particularly over their own bodies, and what kind of medical interventions they choose. And I think we're at a frightening crossroads. And the last thing I'll say is, because this hasn't been touched on, but vaccine passports can easily be tied to many other aspects of our daily life. And I think if you look at what they have in China today, their social credit system could easily become the new normal here in the United States, where if you do not have your 12th or 13th booster, your access to your bank account is not available, right? We need to think very deeply about the long-term effects of this kind of technology and the impact it'll have on our constitutional republic. And I'll just close with that. Thanks a lot.
Thank you. Let's see. Who's next? Ellen? Hold on one second. Go ahead, Ellen.
Yeah, hi, my name is Ellen and I'm a resident of Lenox, so this is appropriate for me. First off, mandates are divisive, and as many people have already touched on, people who are not vaccinated for whatever reason, they're now being segregated, especially when it comes to public. How are you going to shop for food? How are you going to go into restaurants? Where does it stop? But more importantly, no one's talking about, they're touting the vaccine as the wherewithal to end all. The vaccines, my son is double vaxxed with a booster. He's an adult. And I now have my 2 grandchildren because him and his wife are very ill with COVID and they're fully vaxxed with the booster. So you're assuming that these vaccines are creating this miracle that people are going to be safe. And that is, it's a fallacy. So I'm not vaxxed and I have no problem telling you that. It's contraindicated medically for me. So now because of that, I'm being segregated from a huge part of society. And I just think that mandates are very, very divisive. I also feel like I will not comply, even if I was able to take it, because there is a freedom of choice here. And I don't know where we draw the line, but I do think there's no long-term studies. My brother was in the Philippines. He took the vax and died. Was it because of the vax? I don't know. That's not the point I'm trying to make. I'm trying to make that we don't know because there aren't any long-term studies. And so I am worried. And I'm just saying that this is very divisive. And as a member of the Lenox community with several children in the schools and several special needs children that have been advised against taking this vaccine, where does that leave us? Segregated, discriminated. It is very divisive. Mandates don't work. That's not the kind of society we want. That's all I have to say. Thank you.
Thanks, Ellen. Frederick Gillette.
Give him. Hello. Can you hear me?
Yes. Go ahead.
Okay. I'm from Hinsdale, Massachusetts, but I've worked in Lee for decades now. So I just want to say that you don't rightfully have the authority to mandate that anybody put any substance into their bodies. This vaccine is not FDA approved. It is under an emergency use authorization, and it has recorded more adverse events, according to the CDC's own data, than every single other vaccine ever made combined, including over 20,000 deaths. 3 out of every 10,000 people who get COVID die from it. That's not a very high death rate. And this is a violation of the Fourth Amendment of the Bill of Rights and of international law. And I will not comply with such an order. Any police officer that would enforce such an order is violating his oath of office. Any citizen who complies with such an order is forging the chains of his children and grandchildren. Tyranny is built plank by plank. The Nazis didn't just show up one day with rail cars and start loading Jews in. It started with multiple small infringements, the first of which was Jews were not allowed to sit on public park benches, and they complied all the way up to the final solution. In March of 2020, it was 2 weeks to flatten the curve. Now it's show me your papers. British statesman William Pitt said this: necessity is the plea for every infringement of human liberty. It is the argument of tyrants, and it is the creed of slaves. Today it's restaurants, tomorrow it's grocery stores. And I thank you very much for allowing me to speak.
Thank you. Dr. Wall?
Thank you. Yeah, just a couple of things. First of all, Charlie mentioned that talked about appropriately talked about the shortcomings of the the initial series of 2 vaccine doses of the mRNA vaccine or one of the Johnson & Johnson. But right now, increasing numbers, there was just an article by Dr. Wen today, strongly suggested that we define full vaccination in this with this variant as the initial series plus the booster, which that's what I would define it as when advocating for a vaccine directive for indoor dining in restaurants. Because actually, and I certainly agree that this does not as effectively prevent infection as the vaccine did with the earlier strains, but it does have an effect on reducing infectiveness. It does. The recent CDC reported study that I saw was that a fully vaccinated person has about 1/5 the risk of when exposed as a person who is unvaccinated. That is, and much less than that of a risk of serious illness. So the reason I proposed this in the first place, I would never have done this were it not the fact that I was in New York City to watch my wife in the New York Marathon. And of course there, the vaccines you do have to show proof of vaccine. And I did that at restaurants and everybody willingly did that. There was no health department people there. There was no extra personnel to do this. It was very quick and easy. And everybody, as the gentleman from the other restaurant suggested, everybody felt somewhat more comfortable, even though there was no guarantee that they wouldn't catch it. There was less of a risk. And if there's less of a risk of catching it, there's less of a risk of transmitting it in the community. When I came back here and walked into a restaurant, I just automatically reached for my vaccine card. And I was kind of shocked that it wasn't, that I was told I didn't need to show it. And, it occurred to me that a restaurant is, I'm not advocating this for all retail places, but a restaurant, after all, in a very contagious variant, which is almost as contagious as measles from what I've read, in an area of very high transmission that has gone down a bit, but not a lot recently, to have people in a public place with people from different households sitting close together, talking loudly, and spending a long time there, much less of a time than they would in a hardware store or in a food store, unmasked for much of that time, is a high risk situation. Now, I certainly heard what Jim said about no reports of restaurant outbreaks, but he also said we're not contact tracing. And most of the people now, it's so easy to get, they don't know where they got it. So we don't know that there haven't been outbreaks in restaurants, just haven't identified them. I did read one study earlier in the pandemic, I'll agree, that when people didn't know where they caught it, approximately twice as many with a positive test had been in a restaurant in the 2 weeks prior to that than those that didn't have a positive test. So there may be an increased risk of getting it in a restaurant. And if you get it, and so I think that anything we can do to reduce the possibility of infection, even though this does not completely eliminate the risk of infection, we know that. And therefore decreasing it in the community would be helpful, because I believe we do have an obligation to protect the most vulnerable among us, the elderly, the people who can't be vaccinated, the immunosuppressed. And also, if you do run into a person with a breakthrough infection in a restaurant and you catch it from them, you're less likely to become, much less likely to become seriously ill than if you're vaccinated and boosted. And that, if you talk to the frontline healthcare people, that would greatly reduce the pressure on them and the number of hospital admissions, which are now 20 to 30 a day. And this is a dangerous thing. I mean, we lost 3,000 in 9/11. And now there's that many Americans dying of COVID every single day. So this is not a necessarily mild infection. I think that, I'm not saying that people don't have a right not to be vaccinated, they do. But just like with cigarette smoking, if you have a right to smoke cigarettes, but as soon as you're in a public place and exhale, you're impinging on my right to breathe healthy air. And I think the same is true of this. If you're going to go, if there's an environment, a public place like a restaurant where you have to be unmasked for much of the time, then I think that it's appropriate that the unvaccinated people who are more likely to be infected and who may carry the virus in their upper airway for a longer period of time than an infected unvaccinated person, that is a risk that we have a right to be freed of. And so some rights are more than other rights. And I'm not, right now, you can't travel abroad if you're not vaccinated. You can't go to Hawaii if you're not vaccinated. If you're under 21, if you go to buy alcohol, you have to show them your card. So these are not unprecedented things. And I think that what I believe, I feel for the restaurants, and I believe this directive could really be more helpful to the restaurant staff, who are, after all, there all day long, where we're there for an hour and a half. And as Jim pointed out, there are restaurant staff who have been infected. They have to stay out of work for at least 5 days. And I believe that could put some pressure on restaurant staffing. And as pointed out by someone else, there are people who would come from Great Barrington to Lenox, Lee, or Stockbridge if there were such a restaurant, a mandate, feeling more comfortable with that. So I think in short, I believe we do have, I believe this would help somewhat. And I think that, after all, I hope we can return to a more normal situation where restaurants can thrive as they always have, and people can enjoy them. But it's not, I think it is not the mandates and the preventive measures that we take that are preventing us from returning to normal. It's COVID that's preventing us from normal. It is illness. There's a lot of illness out there, and that's what we have to deal with, and that's what's preventing normalcy. And I think this will help. It's part of a whole multi-layered thing. It's not going to do it by itself. It's part of a whole approach that is based on science. And I think the health department should consider science also in promulgating regulations. That's it. Thank you.
Jim, can I ask you something? Are you timing the speakers?
Well, we're trying to, but yeah, we're just going to remind people if we can try to stick to 3 minutes, because there's quite a few people on here. We want to give them an opportunity. So
we need to be fair to everybody here, and 3 minutes is the time that everybody has agreed to. So I'd like to make sure that we stick with that.
Okay, got it. Anastasia.
Hi there, can you hear me? Yeah,
Go
okay.
ahead.
All right, I've never done this before. Okay, thank you very much. I really appreciate that this is being opened up to the community. I will say that I represent a few hundred people that I'm in groups with that feel exactly the same as me, but for various reasons, they're unable to come. So just consider that. I think that, I agree and was going to say a bunch of points that people have said already, minus the previous speaker. It is very clear at this point, Rochelle Walensky was on TV all summer long telling us that these vaccines do not prevent transmission. I read their original studies way before she said that. They actually weren't designed to do that. They were designed and recorded as reducing symptoms. So they finally came around to admitting that to everyone. And so the purpose of vaccine passports or showing a card to get in anywhere is based off of the belief that they confer immunity, that they prevent transmission. But these aren't it's a new technology, and these vaccines aren't in fact proper vaccines. I mean, they don't do the thing that we sort of think of when we use the word vaccine. So I think in one sense, it's good to reframe it. In a sense, I've begun to reframe it like it's sort of like a flu shot in a sense. It might help you deal with it better, but it doesn't keep you from getting it. And so if it doesn't keep you from getting it, the foundation of doing this is completely moot and void. And then where it brings us to is segregation and discrimination, because there's no scientific basis for this. At this point, it's very, very clear that they do not prevent transmission and do not confer immunity. And that really scares me. It very much concerns me. We have worked a lot in this country to get rid of segregation and to get rid of discrimination to get to the place that we're at right now, which is, fairly good. Is there still work to go? Definitely. But we're in a good place in this country because of the work of previous citizens. And I really feel, like a few have said before, it's a dangerous road that we're going down. And like somebody said, Nazi Germany didn't show up to Nazi Germany overnight. Things are laid bit by bit by bit, and you get it into the society, into the mind of the society, and you get used to one little step, and then it's another little step, and it goes on and on and on. So
Ma'am, 30 seconds, please.
Okay, I implore everyone to really come back to normalcy. The Omicron is like the flu, like before, and I think we need to be reasonable and fair. Thank you.
Thank you. It's Colleen. Go ahead.
Hello, thank you. I have actually three things to say. The first thing is that I agree with 95% of what Dr. Kenny said at the beginning of this meeting. And this is very important, and I'm really glad that you're having the meeting. Having said that, the vaccine passport that would have to be checked at the door at the restaurants would put an enormous strain on our restaurants, which are surviving, but they're surviving because they did really, really well with takeout. I think that people should, if they're not comfortable being into a restaurant, takeout, continue to support our local restaurants. I think that's very, very important. The second thing I want to say is I have been vaccinated from coronavirus and polio and smallpox, as measles and hepatitis and mumps and diphtheria and tetanus. And I've lived a good long time. And I believe in that. I also believe in the professionals that we have on our tri-town health boards to make a decision based on science. That is the most important thing. I respect the opinions of the restaurant owners, their professional opinions about what they would face. I also respect the opinions of the health professionals, and I hope you will make a decision based on your professional opinion. And that's it. Thank you very much.
Thank you, Colleen. Let's see who's next. Daniel, you're up.
I'm unmuted. Can you hear me?
Yep, go ahead.
Last caller was, made a good point as well, but please stand back a little bit and take a large picture view. No one's going to like the look of their society as these mandates stay in place with a vaccine passport, for instance. Call it by a different name. Let's say you just have to show a card and it shouldn't seem like that big of a deal. So many people won't. The movement actually just sort of keeps growing. That's what I keep saying. There's going to have to be a compromise. And I think we need to truly understand what the real risks are. So part of what the last one said, talker, I forgot the name, she did say something I disagreed with, and it was something the doctor had pointed out. There are not 3,000 deaths of COVID each day. People show up with COVID and they're in for something completely different. If we accept numbers that aren't parsed out, then we're really not doing our job. So I will not give a blanket just trust to the doctors on the board. I don't want to give that vote, and not from anything personal, but from a deeply clinical point of view. And I think we all need to keep that close to our hearts. And then it needs to be out in public view, since this is a discussion portion of it. It gets out into public view and it gets actually openly discussed. That's what's going to be required with charts and tables and the actual studies. I don't know what the doctor referenced. I do know he just did make a mistake. There's not 3,000 a day that die from this. There's possibly 3,000 that show up that also had corona with them, which you guys may have it too if we cycle a threshold high enough. So things have been so inaccurate. People have seen this. Their measurements aren't lining up fully to say, hey, we want a vaccine passport by any other name. And with this growing, you guys should really start to see that and say, well, what really are the death rates? What really are the amounts age stratified, time stratified, time after vaccination stratified? An earlier speaker, you had brought up, Charles, you're right, time since 20 weeks out, less. And there's currently new data that keeps evolving. We're not even keeping in mind that things keep evolving. So with all of this absolute uncertainty, true uncertainty, err on the side of a population that gets back together. Because think about erring on the side of the other way. So that's all I have to say. Good luck, guys.
Thank you.
Thank you. I'd just like to remind everybody not only to state your name, but also where you're from before you speak. Thank you.
Daniel? Daniel, you had your hand up. Go ahead.
Daniel Seitz.
Oh, I'm sorry. I'm sorry. Can you hear me now?
Yes.
Great. Sorry. Thank you for taking the time. So my name is Daniel Seitz. I'm a resident of Great Barrington, and I've been involved with medical education, accreditation, and regulation for the last 32 years. And I just want to say that there are a number of distinct problems with vaccine passports. The first has already been pointed out by a number of previous speakers. You might call it an ethical problem. When in the history of humankind has it ever been right to discriminate against and to segregate a portion of the population? And oftentimes these actions at the time were justified by the science of the time, but in retrospect, people realize that these things were just ethically wrong. It's also been pointed out that both the Black population and Hispanic population tend to have the lowest vaccination rates. Blacks because of all the experimentation that was done on them by the federal government. Hispanics probably because of concerns around cell lines of aborted fetuses being used in some vaccines. But were there to be a vaccine passport, it would obviously have a racial impact on certain groups, a discriminatory impact. There are quite a number of us who rely on our lifestyle to keep our health. We use natural medicines, eat organic food, exercise, meditate, really take care of ourselves with great impact, a beneficial impact on our immune systems and so forth. So there really is not a one size fits all for healthcare. Also, just many people do not take vaccinations because of sincere religious beliefs. And religion is something that is protected by our Constitution. A vaccine passport would be obviously discriminatory against them as well. And then finally, I think as all of you know, there is simply no one, no entity liable for harm done caused by these vaccinations, which has been pointed out are experimental vaccines, not the manufacturers, not doctors who provide them, not drug companies, government, or businesses. Were there to be a vaccination passport requirement coercing people in order to participate in community life, you may be causing people harm for which there is no liability. Also, I did send to Jim a document with links to over 1,000 case of studies showing the very diverse forms of harm that are caused by COVID, including myocarditis in children. It is caused by COVID vaccines. It is well documented that children are at greater risk of harm from vaccines than from COVID. Imagine if you had vaccine passports that prevented parents from bringing their children to restaurants or to other businesses. Also,
in 3 minutes, buddy.
Okay, just then to finish, as has been pointed out, there's no scientific basis for this. The COVID vaccines do not stop transmission. And finally, just to say that if you do make a recommendation, please make it clear to the public and to businesses that something is a recommendation. I've seen the word directive used, which is confusing. It should be abundantly clear when something is a recommendation or a suggestion. Thank you very much.
Thanks, Dan. Gary, go ahead.
Okay, hopefully you can hear me.
Can hear you. Go ahead, Gary.
Oh, excellent. So I grew up in Lenox, spent all my years there, graduated from Lenox High School, lived a long time in Lee. I'm employed in Lee. I've lived, except for going to college, I've lived my whole life in this area. Community, extremely important. I think that's what we're all about at the end. Now, I'm out in the field every day, servicing systems. I talk with people all over. I've talked probably literally with thousands of people over the last few decades, and certainly many hundred since COVID began. What I advocate is, education, people doing their homework, really taking a look at where they're getting their information. When I talk with people, I like to say something intelligent. I like to have some backup, some sources. I have a recorder. I can record 4 channels at a time. When I hear the president, I want to hear the whole thing. I don't want media interpreting it for me. I don't want to see 2 snippets of it on the daily news. When I hear Director Walensky speak, I hear the whole thing. I want to hear it firsthand. And when I talk to people and they come up with some crazy things, I ask them, where did you hear that? Where did you get your information? Some people say, you know what, CNN. We get everything from CNN. And I don't call them stupid. It's not in my DNA to insult people. But I just point out, you want to get all your information filtered from a reporter. So I advocate people, have an open mind. Let's look at different ways of getting information. Try to set aside your biases and your opinions and stuff, and try to find what the facts are. There's facts on both sides, and I think everybody should be doing their homework. I know my time's limited. So much to say. So a big part of this is the public face, like the CDC. They've done a huge disservice to the country. There's so many studies that they could comment on, and they refuse to. There's natural
30 seconds,
immunity.
Gary. Thanks.
So what's the board going to do about natural immunity? That is superior to the immunity from a vaccine. So what's your comment on that? What do you think about some of the studies? What do you think about the Israeli study? So if you set the standard, is the vaccine is the standard for everything? How can you deny somebody with natural immunity that has a higher standard of immunity? So I just think that the board could do a lot more on their public face, provide some information. Obviously the Tri-Town, all you think about is new cases. That's it. There's so much more to that in making decisions as to what should be done. You can't just, what about hospitalizations, deaths? How
Gary,
serious
3
are-
minutes. We want to let other, you can come back if we have more time.
Okay, very good. Thank you.
Okay, folks, Noah Lawson. Noah, for some reason, when I allow you to unmute, it's showing that you're using a really old Zoom platform. But what I'll do is I'll promote you to panelist real quick so you can speak. See if that works.
Can you hear me now?
Yeah, go ahead. Yes,
Now?
go ahead.
Great, thanks. So my name's Noah. I currently live in Pittsfield. I'm from Lenox. Can everyone still hear me?
Yes.
Yeah, go ahead.
Great. All right, thank you. So just to say, I work in the home improvement field. I work for myself. I have many, many customers. Many of them are out of towners who come to the Berkshires. I vaccinated, spend large amounts of money. If you were to talk to my clients, you would find I'm known for my fairness, for my reliability, for my creative problem solving, my willingness to be available and show up and work. My first thought is that I would share personally is after this whole lockdown situation globally, I actually will never be voting for anybody who's sitting in office at the national or state level again. And the reason for that is that not a single person that we voted into our government offered to give up their pay when they were locking down the entire economy. And I thought that was very, very shameful and not really in keeping with good ethics. I also feel similar about local town board members. When we shut down Main Street Lenox, many of those stores are my customers. And the entire year I shopped at Home Depot and Walmart freely. And I shopped at BJ's freely. And I just thought I was really disappointed in how little people were willing to just stand up, keep the stores open, see what would happen. Obviously, there were no federal agents who were going to storm Lenox and raid the buildings or do anything of such a nature. And I was disappointed in local leadership that we let the corporations stay open. We let $5 trillion of money go to the billionaires, and we really did nothing to help our locals in that sense. My points are pretty simple. My first point is simply I'm Jewish. I was raised Jewish. I actually sat on couches as a child in Brooklyn, and I had relatives and friends who showed me tattoos on their arms. I listened to old ladies tell me about watching their children be pulled out of their arms and killed in front of their own eyes. I've grown up in this history, and I'll never show a passport. I just, even if I just won't. I just refuse to. My next thing is that I think in keeping with how much the local businesses have suffered, I don't see how it's fair to make them have to enforce this. I also don't see how it would be enforced. If you say, well, we want this to happen, and the local deli says, well, I'm just going to let everyone eat there, who's going to enforce it? Are the police going to come in? Are agents going to come in? No, just nobody's going to do it if they don't want to. And I think to keep the peace and to keep things fair, the best thing to do is let it be open. Those people who are very frail and at risk need to stay out of restaurants. That's why we have DoorDash. That's why we have delivery. That's why we have grocery stores.
15 seconds, Noah.
Okay, thanks. So that's my opinion, is that it needs to stay open. And ultimately, if you keep ratcheting things up like this, I already can't take my children because I'm unvaccinated to the museum. I'll just leave. I'll move south. I'll start my business there, and all of my customers will not be able to find anybody to take care of their homes. And that's my opinion, is we should leave it open. Thanks.
Thanks, Noah. Bear with me. Andrew, you're up.
How you doing? My name's Andrew Wiley. Excuse me. I have a business in Main Street in Lee. I'd like to point out to
Jim, I think we lost Andrew.
I see Andrew, he's still on. He's allowed. Try, Andrew, you there?
Can you hear me?
Yeah, go ahead. We lost you.
Okay, my apologies for that. My name's Andrew Wiley. I have a business on Main Street in Lee. I'd like to notify everyone that we have vets that are coming back from fighting for this country that cannot get a cheeseburger in Boston without showing their card. This is despicable, and it should sicken everyone that can hear this. The board doesn't sound like they're really for a passport. The board should understand that they do not have the authority to impact and put these mandates on the people. There will be recourse and people will push back. The town of Lee does not need any more litigation along with this PCB dump that this board should be voicing as a concern for public health if we're all concerned about public health. This is not a vaccine. The vaccine is supposed to stop infection. This is not stopping the infection. It's potentially a therapy. I will say that. Do we remember how this went back in the breakthrough cases were rare? That's what they said. The breakthrough cases were rare. That is false. MassLive reported last month that 44% of the COVID cases are breakthrough. It has jumped to over 50%. The vaccine/therapy is not stopping infection, and the vaccinated are spreading the disease just like the unvaccinated. We cannot discriminate against people. The natural immunity, we cannot discriminate against the natural immunity, the people that have natural immunity. And to go with the other people that chimed in here, the minorities, the African Americans, only 10%, according to the CDC, as of January 12th, are vaccinated. 20% of Hispanics, 7% of Asians. We cannot discriminate against these people, and we cannot discriminate against natural immunity. There are people getting sick from the vaccine. They are getting sick from the vaccine. You cannot force these people to take booster after booster, this unlimited booster plan. If this board was to sign this into a mandate, we can't force people to take a booster every year to enrich these vaccine companies. People are leaving this town to eat in another place just because they have to wear a mask. You have to realize that people are leaving Lee to eat in other places because of just the mask mandate. Could you imagine what would happen
30 seconds,
if
Andy.
the vaccine mandate was put into place? I stand with all the restaurant owners and everyone else that sees the dangers of this. You know what this is about? Just look at the stock of Moderna last year. It's up 4,000% in 1 year. We know what this is about. The biggest criminal fines ever were put on these companies. We're not taking it. Nobody's taking it. We all want COVID to go away, but this vaccine passport is not the way to do it. Thank you.
Thanks, Andrew. Eliza?
Hi, Elisa Kameyer. Thank you guys for having this discussion. I live at 1 South Hill Road in Stockbridge, and I have 5 children, ages 19 to 2, and our family is not vaccinated for religious reasons. And I have to say that when we first moved to the Berkshires 10 years ago, we thought that it was a community that really respected people's individual choice and was tolerant. And my voice is shaking because I'm going to cry. Just every year we've watched It's a Wonderful Life in the Mahawi, and we're not allowed to go there as a family anymore. My kids want to see Spider-Man at the triplex. They're not allowed to go. Prairie Whale used to be a place where my husband and I had date nights. I just emailed Mark Firth, like, what's going on? What do you think you're doing in this community? The reason that I majored in public policy at Stanford and got a law degree at Stanford was because I really care about community. And I care about how community is impacted. And to me, just, in the same way that I'm teaching my children not to discriminate against people who are a different race or who are a different religion or identity or politics or any of that, that I want them to accept and love all people, however they are. If they think differently, that's okay. And to me, just these past 2 years in this community has been really difficult because I didn't realize that all it took was the idea of sickness and the idea that a vaccine is the answer and the savior for them to turn against people that you know, they don't think are doing the right thing. And so anyway, I just I obviously am hoping, I mean, I've been really impressed so far with the board and how open-minded you guys are. I appreciate that. So thank you for allowing me to speak.
Thank you. Andrea Goodman, go ahead.
Hi there. All right, you can hear me now?
You can hear you. Go ahead, Andrea.
Hi, Jim. So I spent since December of 2020 working for the Community Tracing Collaborative. So I had access to Maven, which you talked about was the system by which every positive case in the state was reported through Maven. And then we called them, every single positive person in the state. And yes, back in 2021, there was a lot of restaurant transmission of COVID, people sitting at bars in close proximity with one another. But since September of this year, I've been working for the Berkshire Public Health Alliance, our 16 towns, doing the same thing, calling every single positive person. Lately, we're calling those over 65 and under 18. And, but that was just a recent addition. Before that, I mean, I think that's just only been about 3 weeks. Before that, it was really everybody, North Adams, you know, at all different levels of vaccination status. And I have to say, to back up what Jim says, never found a cluster from a restaurant or anybody even reporting that they got it in a restaurant. What I hear from people is that they're getting it through household transmission for the majority, or if they're children, they're getting it in schools from each other, many of them playing on sports teams where the masks are falling off their faces. But that is what the transmission is most likely to come from, no matter what the vaccination status. So I just wanted to add that because I'm backing up what I heard Dr. Kenny say and what I heard Jim say. And I'm not even sure I'm authorized to even speak at this meeting, but because I'm a resident of Lenox, I'm speaking to you now just because I have my boots on the ground. So thank you very much.
Thanks, Andrea. Phoebe Williams, go ahead.
Thank you for having me. I want to talk about one thing, which is there's talk about the risk of vaccination and you know, the lower risk for people if they're vaccinated. But one thing that isn't been mentioned is the risk of not being vaccinated, but also the seemingly automatic assumption on the part of people who are vaccinated that they are in greater danger than when there was somebody who's not vaccinated than they would be if there were somebody who is vaccinated. There's there's an automatic, almost a separation and sense of danger, and it's very strange to be on the receiving end of that because I'm not vaccinated. I'm healthy. If I weren't healthy, I wouldn't be in public. Maybe one thing that's underlying this is the I don't know, hypothesis maybe that there is that you can carry the disease if you don't have symptoms. But I have heard the opposite said about that. I've heard to say that you're absolutely not contagious if you don't have symptoms. But there, I think one of the real dangers of this is it perpetuates this segregation. And also what happens is the scapegoating. The reason why things are bad is because of the unvaccinated. That's been said in many, many different ways. I actually don't listen to the news anymore. But so I think that that needs to be taken into account. If the board were to put in place any kind of a mandate that would perpetuate automatic scapegoating and unfair and inaccurate assessment of unvaccinated people as being contagious. And then the other thing I want to say is that somebody mentioned science, and we want to hear the science. And science has been used over and over and over again by people who are vaccinated. I don't want to look at anything. I just want to hear the science. But the thing is that there's been a heck of a lot that's been suppressed, and what do you say? People have lost their platforms and stuff. There's a lot of science out there that isn't being considered science. So there are a lot of, so to say that we want to have a scientific perspective, and then to assume that that means that's on the side of the vaccinated.
Phoebe, can you wrap up? It's 3 minutes, please.
Okay, I want to have a public forum where all of this stuff gets discussed publicly. Thank you.
Thank you. Carol, go ahead. Unmute yourself.
Hi, can you hear me?
Yep, go ahead.
Okay, I'm Carol Gillette. I live in New Marlboro, but I worked in Lenox for the last 6 years up until the end of December, when I was relieved of duty because I refused to get vaccinated. My job was taking care of children that were had mental issues in a residential setting. I was exposed multiple times to students with COVID. I was tested weekly. I've never once been come up positive. It's always been negative. And I also have comorbidities. And my weight is not where it should be, okay? But never once did I get sick because I took the responsibility as a human to take care of my own health by following certain nutritional guidelines. I see this idea of passports is that people are taking our power to take care of ourselves because you think that we cannot do that. Well, that's not true. We do know how to take care of ourselves. If I was sick, I wouldn't go out. If I was sick, I would not expose myself to my elderly parents. This would be a violation of the Civil Rights Act of 1964. And I think that really you need to consider the fact that, obviously OSHA is already going to be knocking down the idea of having mandates to begin with. I really think that it needs to be seriously looked at as a violation of our rights to put in place a mandate such as this. And
Thank you,
that's all
Carol.
I have to say. Thank you.
Lev, go ahead and allow yourself to unmute and you can speak.
Yeah. Hello. Can you hear me?
Yeah, go ahead.
Hey, hi there. Thank you. This is Lev Natan. I live in Housatonic. Just want to say, first of all, thank you to the board for having the wherewithal, the thought to have a public hearing. And then I want to say thank you to each and every one of you who has spoken so eloquently tonight. You know, this community is intelligent. You know, we think about what's going on in our bodies and then what's going on out in the world, and where there's disalignment. So I know for myself, I'm not vaccinated, and I, you know, for a long time saw, well, you know what, I don't know if I want to be one of the people that is being experimented on. And as we've looked over the course of the last year or 2 years, we've seen the percentage of effectiveness, you know, go down. First, it was said 99% effective for, you know, preventing transmission. As someone earlier spoke, a vaccine, you know, from our history, we know the word vaccine means prevents transmission. And so the use of that word vaccine is actually inappropriate at this time. Yeah, like a flu shot is more appropriate. So that's the first thing right there is, and then we just heard someone spoke who's on the ground saying that people are not getting it in restaurants. So just wanted to affirm that right there. And then also the impact that is made on restaurants to make them go through that administrative work when they're already, you know, getting hit hard in this economy. So just all of those things to care for your own community, this is actually preventing that from happening. And then, of course, you know, the elephant in the room, which has been spoken to so much, is the Pandora's box that is opened when we segregate people. I also am of the Jewish heritage. And right when this started with the vaccines, I thought about Nazi Germany. I thought about it, about yellow stars on your shirt. You know, so this is the beginning right now, is you have to show a card. And then at some point, they're going to put it on our arm. And then we have a digital chip. You know, it's already
15 seconds left. Thanks.
So just wanted to say that much, and just to say thank you again for this opportunity to have a capacity to think together about these things that are so important for our children and the future generations. Thank you so much.
Thanks, Lev. Whitney, go ahead. Whitney Asher.
Hi, thanks. My name is Whitney Asher. I live in Lenox. I own a business in Lenox. I own a business that is subject to a license from the Tri-Town Board of Health. I wanted to just make a comment from a completely different angle, which is if you do actually decide to issue any rules or directives or anything about this for license holders, you're going to need to do a lot of work and be very careful, because this is a very complicated issue in terms of describing what it means to be vaccinated or boosted, or the dates for that, or if there is a different date if you've actually had COVID, or if you've had COVID with some therapies, which may involve what your antibodies are and the other subsequent, you know, possibility of receiving a vaccine or not, as well as if you want to make any exceptions for any kind of medical contraindications or anything like that. The other thing that I would urge you is, if you're going to make any other rules about this, that you be very careful about how you make the rules for dining indoors or dining outdoors, for staff working indoors in direct contact with the dining public, for staff working in restaurants who are not in the direct contact with dining public. Because if you don't make these rules, should you issue them, you know, clear and complete for everything, it's going to be very hard to implement and won't be effective at all.
Thanks, Whitney. Bear with me, folks. Redbird, if you can please say your name, where you're
Sorry,
from.
my little handle on that thing. I'm Cardinal Jackson. I live in West Stockbridge. I'll be brief. We have zero liability on these vaccines. We have no data. Well, very little. I think we have 55 pages that the FDA has actually released. The rest they're digging their heels in on. We have no long-term studies. The vaccines don't prevent disease or transmission. We are taking most of our information from the CDC, and I'll just remind everybody, the CDC is a privately owned corporation. It has shares in the pharma companies, especially those making the vaccines. The CDC owns over 57 vaccine patents and does not hold medical authority through any government institution. The CDC is in the business of vaccine sales. As any corporate business, it strives to accumulate profits from its shares, namely those of big pharma companies. No one can give informed consent given all of the things that I have just listed. No one, therefore, can ask for a vaccine passport based on safety and efficacy of these things for which we have no liability, no data, no long-term studies, and a very compromised information platform that we are getting most of our information from. So the vaccine passports have absolutely nothing to do with science whatsoever. And I think it would behoove anyone responsible for the well-being of the citizens of any of these communities to make decisions based on questioning what these vaccine passports are actually for, given that they are not based on science whatsoever. And I just want to thank you for having this forum because it's been really, really great to hear everybody speak. So thank you very much.
Thank you. Joseph Cooney, go ahead.
I think you got me now, right?
Yes,
Can you
go
hear me
ahead.
okay?
Yeah, go ahead.
Okay, great. Thank you. Yeah, practicing physician in Stockbridge. Appreciate the volunteer service of the health board. Very passionate about the health of the community and very respectful of the standard of care. There's no argument for a mandate, in my opinion. The assumption that a medicine is so right for everyone that some will be delegated to a second class is not supported. Educate, provide access to the desired intervention, encouragement, that's what's warranted. You know, transparency, resist scapegoating. These are my points of view. Because there's a risk, there must be a choice. Yes, myocarditis. Yes, cardiovascular inflammation that persists in the blood, as published in the journal Circulation. Yes, long COVID, all after vaccination. There must be choice. Mandates are saying that we don't want your voice. We don't want you to think. We want outcomes. There's nothing more important than sovereign thinking and developing citizens in society. Let the people decide. There's many well-spoken people here. Respect them, educate, and let us as citizens decide. And the last thing I'll say is creating the two-tiered system is an extremely dangerous proposition. Othering the non-vax, if you don't think that's happening, you know, I'll just have you recall Trudeau's comments that saying that non-vaccinated people are more likely to be misogynists or racist, and also that Macron's statements within the last month calling French citizens that weren't vaccinated, these are basically non-citizens. And you know, that Biden had a speech at the end of the year. These are all kind of scapegoat and very dangerous. And you know, again, I don't support this. The medical community can actually stand up to this and not be pulled into this. So appreciate it and keep up the good work. Yeah.
Thank you. Let's see, Bob Healy, go ahead, Bob.
Yeah, hi, Bob Healy, 199 Main Street in Lee, more commonly referred to as the Chambéry Inn. I just want to start, I absolutely thank this board, for their time and the level-headed discussion of this matter. I've listened to everything everybody has to say here, and I just wanted to add a couple of points from our point of view. The proposal is kind of in direct contradiction, I would say, of just the very nature of a hospitality business. We are not scientists, we're not police, we're not law enforcement officers. We're people who are supposed to make you feel welcome and let you leave your cares at the door and enjoy yourself. We don't support this, and we should hope that the board doesn't as well and would consider other factors in the community besides COVID. Having young children, I gotta say, just the mental health piece that has come out of this whole thing should be almost more concerning to some degree. I think that's really all I had. Thank you, guys.
Thanks, Bob. Let's see here. Randy Jordan. Just hit the unmute button. You're good to go.
Hi, can you hear me?
Yep,
you can
go
hear
ahead.
me? Okay.
Yep, go ahead.
Well, thank you for this meeting, and Charlie, I appreciate your opening statement, and you're bringing some of the points about that things have really changed with this variant and what's happening, and so many of the citizens have said so much that's so important to me that I wanted to say. So I'm going to just keep it simple. My husband and I, we try to spend a lot of money locally. We try to buy from local stores, even though it's more expensive. And we just try not to buy online. And we have been basically not going to any venues where there are mandates. And we don't support those people at those businesses, but we want to support them. We don't go with our friends or our family to those places. We want to support all these restaurants. We want to support the workers. The economy is, as you know, so crucial to the well-being of our community. And I'm I live in Great Barrington. I'm a healthcare practitioner. I'm a physical therapist, and I've been one since 1985. I've done a deep dive into all this COVID information, as it sounds like a lot of the community members have. And if you do, after all this, choose to make some sort of a mandate or a suggestion for a passport, I would like to see the science behind what you're doing, the studies that support that. And I do want to say, I really appreciate your listening, that you've given us this voice. I really think it's wonderful, and it's really important for the health of the community. But I just want to support our local businesses, our restaurants, everyone that depends on them. And again, like some of the people said, they can't bring their kids to some of these places. My husband and I it's just been really sad, all the places that we're not going to now, but we're just finding other ways to make it work. But we want to spend our money here with our fellow small businesses. So, and let me see if there's anything else. I did want to say, I don't want to embarrass anybody, but I didn't understand James Wooletz's what he put in the chat. So I'm hoping maybe he can explain that at some point. And thank you so much.
Thanks, Randy. Yeah, it was just a chat because some people are sending me, even public people are saying it's a long meeting. So we're trying to accommodate everybody. Kristen, go ahead.
Yes, hello. This is actually Justin Kay. I'm Kristen's husband, and I was born and raised in Stockbridge, Mass. I now live in Great Barrington. And I just wanted to touch on a couple of things. So I noticed there were maybe a couple of members here who, when somebody was talking about the non-FDA approved vaccines, I think I saw some eye rolls or maybe some head shakes. And I just wanted to clarify that there are no FDA approved vaccines available in the United States. Now, if anybody here has any information that they'd love to share, I'd like to hear it, because Comirnaty, which is the only approved vaccine, is not available. So that's one thing. So I what I'm noticing is in some of these meetings, oftentimes things are said and there are eye rolls and head shakes, and then no one is there's no fact checking going on in real time. So I just wanted to make sure that we were really clear that there is no FDA approved vaccine, not in the United States. So you can roll your eyes, you can shake your head, but that doesn't change the facts. So as long as you know, you're in this position that you're in, I'd really appreciate it that, you know, we acknowledge the facts. So I think that's really important. That being said, the other thing is there's actually a study published by the CDC in late October 2021 that found that actually unvaccinated adults who tested positive 3 to 6 months earlier were 5 times more likely to test positive for the virus than vaccinated adults who had previously been infected. 5 times less likely. I don't know, is there any comment on that? Or I mean, the other thing is, if you've had 2 shots, and unless you're, I believe it's 2 weeks beyond your second shot, you're still considered unvaccinated. So there are many people who got 1 shot and then they got their second shot, and maybe they're a week in after their second shot, and those people come down with COVID or even die, and they go in the unvaccinated group. So
15 seconds, please.
That's another fact that's sort of being hidden in the numbers here. So as long as we're talking about vaccinated versus unvaccinated, I think we need to be really clear what that means. Thank you.
Thank you. Patrick, go ahead.
Hi, my name is Patrick White. I'm a selectman in the town of Stockbridge. First of all, I wanted to thank the elected Board of Health members who make up the Tri-Town Board for their incredible hard work in good faith, trying to keep our community safe through 2 long years of this stuff. And I want to commend you for sitting through and listening to many impassioned folks on various sides of this. I would just encourage you to, you know, do the job, which is protect the health of the community. And I have no opinion on what action you should take on this, because I am not a healthcare professional, as most of you are. But I feel like you guys are not the Chamber of Commerce. You're not economists. You are healthcare professionals. And whatever you decide to do, I will support, because that's what we elected you to do. And thank you for your service. That's all.
Thanks, Patrick. Okay, we have Jason and Lisa.
Hi, my name is Anna and I live in Cheshire, but I work in Lee. And first, I would like to thank you for holding this public hearing and upholding the values of our constitutional republic. My message tonight will be very short. My faith in humanity has been renewed tonight. Thank you to every person who has come together to oppose vaccine passports. I am proud to be surrounded by so many citizens who support freedom. This is what our country was founded on, and I am proud to stand with you to uphold it. Thank you.
Thank you. Let's see, we have Kathy.
Hi, I'm Kathy Regan from Housatonic. First of all, I wanted to just thank everybody that did speak tonight. It's nice to hear so many highly intelligent people speaking. And I also wanted to find out if a recording of this meeting is going to be posted online. I hope so, and I hope you can share that information with everybody when we're done, where it's going to be found. I'm going to repeat a few things that other people have said tonight, but I think it's extremely important. I think that people have been brainwashed constantly with a constant feed of propaganda to think that segregation and discrimination is normal and necessary with what's happening. And I constantly hear public officials saying safe and effective over and over, but we never hear those same public officials talking about the CDC's VAERS adverse event reporting system. Currently, there's over 1 million reports of injuries from these shots and over 22,000 deaths reported. You know, that's significant. That needs to be taken into account when everybody's saying safe and effective. Well, if you've got over 22,000 reports of death from these shots, why isn't that being talked about? Why isn't over 1 million reports of injuries being talked about? And, you know, on this whole token of mandates, like if we think that it's okay to do mandates in any faction of our society regarding health, why don't we outlaw cigarettes and fast food and force people to exercise and take vitamin D? I mean, we would never do that. It would save countless lives. It would reduce COVID infections, but we would never do that in a democracy. So it doesn't make sense to make other mandates either. And, you know, it's agreed now that these shots do not stop infection or transmission. As others have said earlier tonight, Michelle Walensky from the CDC has said this, as have many other scientists. They do not stop infection or transmission. But then the next argument is, do the shots still protect people by lowering viral load? And that's being shown in study after study around the world to be blatantly untrue. And yet it's still being said like it's fact, but it is not true. And so we need to actually look at the studies that show this. And I don't think, you know, it's great to be talking about opinion and how we all feel about whether this should happen or not. But I do think we have to look at those studies. You know, there was a preprint paper by the Oxford University published in the Lancet, and it found that vaccinated individuals carry 251 times the load of COVID-19 viruses in their nostrils compared to the unvaccinated. This is Oxford University. According to an article in the British Medical Journal regarding
15 seconds, ma'am.
And study after study. So 2 recent studies showed that 80% of the Omicron cases were in double vaccinated individuals. We have many other studies that we can show. So I think that these things need to be considered. Thank you.
Okay, Mr. Chair, everyone else has spoken. There's no more hands raised, so Dr. Kearns had his hand raised, so I guess I'll turn it back over to you. I mean, there's a couple other people that have already spoken once are now starting to raise their hands again. So let me know how you want to deal with that.
Okay, so we've had everybody get an opportunity to speak so far that wanted to. And now you're saying there are a couple of other hands that are raised?
There's 3 more hands raised. Kathy, who just spoke, Anastasia Blaisdell, and Frederick have already spoken, but they've raised their hands again. Do you want to just maybe?
Okay, well, you know, the meeting is getting very long, so we'll give these 3 people a chance to speak. I'm going to ask them to make their statements not be a repetition of what they already said. If you have something new to add, please do it. And understand that we've given, you know, a lot of our attention to this, and it is a long meeting, so we want to make sure that everybody still has a chance to express their views. So we'll give you the chance, but I would like everybody to understand now that this will be the end of the public discussion for this topic with these 3 people. So please, Jim, let them speak, and then we'll turn it over to Dr. Kearns.
All right, Anastasia, you had your hand up for a while.
Okay, thank you so much. And I really appreciate it. And I recognize it is long. And so just thank you very much for this other opportunity. There's a few things I didn't get to say earlier. A lot was said, so I respect that you just said not to repeat them. So what was left was just that I do actually encourage the board to either not make a recommendation about this, or even to have the courage to say, you know, given all of the facts and all of our evaluations, you know, and state the reasons, you know, be straight up, put the education out there to people that maybe haven't done a lot of their own research, that are only listening to mainstream media, which is 70% funded by big pharma. And there's a reason why they're only saying certain things, and we're only getting certain things on mainstream media, that we urge businesses to not enforce these mandates. I mean, how about that? That we stand up for courage, that we stand up for our foundational rights of this country and how we started and what we stand for, and put the information out there, you know, in light of new studies, X, Y, and Z. You know, the members that of our community that spoke tonight can, you know, forward studies to you guys, because I know you only have so much time to find all these studies. We're happy to help you. They're all out there. Nobody's making up anything. And lastly, I want to point out, I'm not sure if you know, but there was a trusted news initiative, it's called, that was signed, put forth by the BBC in the very beginning of this, that all the major news networks agreed to not put forth any information that was negative about the vaccine, and that everybody would sound harmonious. So I think it's important to recognize that there is a mechanism in place that's being funded by people that are making a lot of money from these vaccines, backing and supporting and creating what we're seeing on TV. So it's just really important to wake up to that fact. TV is not what it used to be. Unfortunately, there's extremism in the right and the left, and it's really not about that. It's about being moderate and realizing what is really happening in our world, so we can stand up for what's long-lasting truth. All right, thank you so much. I appreciate you all very much.
Thank you. Fred, go ahead.
Can you hear me?
Yes.
Okay, I just wanted to make a very quick point. Dr. Kenny, you and a couple of other people both stated that we were a democracy. We're actually not a democracy. We're a constitutional republic. A democracy is basically two wolves and a lamb voting on what to have for dinner, where in a constitutional republic, our rights are protected by the rule of law. And that's the end of my point. Thank you very much, and have a great night.
Thank you. Gary, go ahead.
I just wanted to add real quickly that just merely proposing this is just another severe beating to the community. It's such a hot topic, and people feel so strongly about it that, you know, and I just want to raise, you know, maybe a learning moment from our neighbors in Great Barrington. They proposed to vaccinate every child in town. They put it in the paper. They stirred up the whole community. First meeting right out of the gate, it was told they don't even have legal authority to do it. I mean, why put a community through that? And despite what the attorney said, they continue to go on. Who can we vaccinate? We got to vaccinate the sporting teams. We have to do this, we have to do that. And they spend another, I think, half an hour discussing who they can vaccinate, when the town attorney said, you cannot, you don't have the authority. And I checked with the Board of Health down there and wondered, why is the Board of Health not mandating vaccinating every kid? And it's, you know, it's the school committee. And I did this sitting from my chair. I went and checked with the Board of Health. They made a very, very wise decision. We could all learn from that. The decision from the Board of Health was that there's so much controversy. There's so much data that's still being available. You know, we can't guarantee the safety of everything. And this is not the time to start mandating vaccines. So I think we could all learn from that. You know, people should be very cautious what they throw out there in public, and really stress everybody that's already been beaten to death by all this. Yeah, I'll conclude with that.
Thanks, Gary. So, Mr. Chair, so Kathy Regan has already spoken, but there's two people that raised their hand that didn't speak. So I'm going to call on them now, and we'll go from there. Diana.
Okay, well, Jim, I'd like to not keep having stragglers come on. If somebody is, we'll go with these people, but the meeting is getting very long now. And if people intended to speak in the first place, that's one thing, but we don't want to have stragglers coming in and speaking. I think at this point, we need to have people who participate in the entire meeting.
Yeah, so it'll be Diana, then we'll wrap up with Annette. Go ahead, Diana.
Okay, am I unmuted? Yes.
You
Can you
are.
hear me? Okay, I just want to ask, because I was listening the entire time, what Massachusetts law, can you just direct us to what Massachusetts law allows the Board of Health to make either, a mask mandate or a vaccine mandate? And especially given that all of these, the masks and the testing and the shots are all, every one of them are all under emergency use authorization. So I'm just curious, like what law allows any of you to make, to try to make people think that they have to do these things? Like what law? And everybody should look at this. I don't even understand why people think they have to do it just because the Board of Health says they have to do it. All of these items are under emergency use authorization. So that's all I want to say. Thank you.
Diana. And we'll wrap up with Annette. Go ahead, Annette.
Hey, hi, can you hear me?
Yep, go ahead.
This is my first time and I was a little reluctant to come on, but my name's Annette Landon. I'm from Pittsfield and I like to patronize South County and we're all in one county. And so it's relevant because it could come here, and I was listening in the beginning, Mr. Kenny, and I was agreeing with a lot of what you said, and at first, but what really called to my attention is when you mentioned the word democracy, and in a democracy, you don't always win. Well, when you're looking at maybe 51% ruling over the 49%, is that really fair? It might be fair when we're talking about parking or a bridge, but when you're talking about injecting something into somebody's body that person thinks may kill them, may not kill them, maybe in the future, how you can impose that on your neighbor. And that I do believe this will affect the restaurants' businesses because requiring vaccination passports isn't going to have those people go out and get vaccinated. It's going to cause more of a division. It is a segregation. And it's coming right down to our hospitals. There's a 31-year-old man in Boston waiting for a heart, wouldn't get the vaccination. Father of two, one on the way, taken off the list. So, my doctor dropped me as a patient because I wouldn't get it. It's really hitting home. And that's all I want to say.
Thank you, Mr. Chair. That should wrap up the public discussion. If you want to make a motion to.
Okay, thank you, Jim. All right, so I'd like to ask the board members if they agree with that. I'd like to have a motion to end the public discussion on this topic at this point.
Make a motion.
A second, please.
Second.
All in favor?
Aye.
Anyone opposed? Okay, thank you all from the public. I realize that we've been through a very stressful 2 years and there are a lot of different opinions pointed out there. So we very much appreciated hearing all of the opinions of people. Thank you very much. I believe Dr. Kearns had his hand raised and we moved him over here since he's on the board from Lennox. So John, you want to say something?
Charlie, I don't think John is on anymore. He just texted me to say he wasn't on.
So he should rejoin it and then Jim just give him a chance to say something.
Yeah, for some reason he got bumped out. Hold on. Hold on 1 second. See if that works. John, are you on? Dr. Kearns, can you unmute yourself if you want to speak?
Hello, can you hear me?
We can hear you. Go ahead.
Yeah, actually, I didn't need to speak. For some reason, I got bumped off as a panelist, and for a while, I was listening to everything that everyone said, but I couldn't see myself, as a panelist. So, but I don't have any comment right now.
Okay, does anybody else on the board want to say something? Okay, thank you all for your attention. Now, the next order of business is if there's any new business that the board members want to bring forward. Does anybody have any new business they'd like to discuss?
No.
Ray?
No, Charlie, I don't.
You don't? Okay. All right. So now
No.
we'll move down to the last order of business, which is the citizens discussion. I hope everybody realizes that this was intended for topics other than the one we've already discussed. And so please, if you can, if you have something new to add about a different topic, please go forward with this. And we'd love to hear you speak. So if you want to raise your hand about that, please. But I do think that we've given plenty of public discussion time to the previous topic. Thank you.
Okay, so looking at the attendees, we have one person with their hand up. Tanya, if you want to go ahead and speak, if you have any comments for general discussion, go ahead.
So yes, can you hear me?
Mm-hmm.
So I'm Tanya DeFries. I live in Lenox, Massachusetts, and this has nothing to do about vaccines, masking, or unnecessary testing. It does have to do with Lyme disease. I learned about government corruption when my husband was diagnosed with MS for 5 years. It was Lyme disease. And my daughter at 13, we thought she was dying, being told by the doctors there was nothing wrong with her. It was Lyme disease. That's what sent me down the rabbit hole of government corruption. Read Bitten. Take a note. Read Bitten by Chris Newby. Lyme disease was brought by our government. Operation Paperclip. Operation Mockingbird came out at the same time, which that is what happens when we listen to the television drumming into our heads what they want us to hear. So all of this is connected. It's all connected, and everyone will learn that. I completely agree. I think it was 29 or 30 out of the 35 people that called in. I'm completely on their page because I've been researching this endlessly. My heart is completely in it. And there should not be any mandates. Mandates are not legal. Thank you for your time.
Thank you. Mr. Chair, there's no other hands up. If you want to do one more ask, and you can move on from that section if you want.
Well, I think everybody, if somebody else has something to say about another topic such as just was brought up, please raise your hand right now. Otherwise, I'd like to ask for a motion to adjourn the meeting.
So move.
Second.
All in favor?
Aye.
All right. Thank you very much for your attention.
Thanks,
Thank you.
everyone.
Thank you.